So what's the difference between clinical populations and community populations? Because if we study all those folks out there, by the way, let's get right to the moment. How many people do you think were sort of on the bubble in terms of their alcohol use? Until suddenly, unexpectedly, they don't have a job in 2009 and don't have a career. They don't have a job in the place they were expecting to retire from in 10 years. Now, if I take 1,000 of those individuals, what do you think their psychoactive drug use looks like these days? So what can we expect? In the economic climate we're in, we're going to see a rise in alcohol-related problems in the midst of this kind of difficulty we're going through. Some of those individuals will rebound from that experience. They'll retrain themselves. They'll find other occupations. And 5 years later, it'll be nothing but a little blip in their life. And some of those people are going to be dying of addiction. Are you with me? So what's the difference between the two? Because here's the crucial point. If all these people get well without treatment, why do we need treatment? Right? I mean, if we have this huge maturing out natural recovery phenomena going on, is treatment dollars just a waste of time? Will those people eventually just get well on their own? Well, here's the problem. People that you and I see in treatment don't look anything like people who are out there experiencing natural recovery. And here's why. Higher personal vulnerability. I'm going to do the whole list and I'm going to come back and do some of these. Higher personal vulnerability. I'm going to talk about family history. The second that I got a family history of alcohol and other drug problems, what's my prognosis of transient versus chronic problem? Chronic, right? I mean, I'm bringing some weight behind me, some intergenerational momentum that's going to tend to make this a prolonged problem rather than a brief problem. We're going to talk about lowered age of onset and some other things in a minute. The more severe that problem is, what? The greater the problem severity, the less the likelihood of natural recovery. Now, what if I give you multiple problems? I give you multiple drug choices. Oh, hell, let's just add injection drug use as part of that, okay? And then I add a co-occurring psychiatric illness. And then I add something like homelessness, chronic unemployment, a history of being a felon. Now, what's my prognosis in terms of chronicity? Yeah, if I got all those and you're waiting for me to mature out, you got a long damn wait. Okay, greater personal and environmental obstacles to recovery, lower recovery capital. Problem severity, breaking intergenerational cycles, okay.